But unfortunately, only 11 flats were occupied and we didn't know this. We did a lot of camps in and around schools there. We did because we knew we both had a lot of contacts. So a lot of schools were involved. We did a lot of campaigning. We did a lot of discount charges for those people who would come. People who are having fresh talent, raw talent, it takes a lot of effort and time to establish. Very, very important DCI rule, which mentions that there should not be any dental clinics around 200 meters in and around. So we thought this is the best place to start it. Even after a year, that's when it hit us that we have to dissolve it. And also, I would definitely want to know, the saturation is so high in Bangalore with dentists pulling on everywhere.
Hi viewers, I'm Dr. Prince. Welcome to my channel, Dental Treasures. So after years of toiling and paying so much of amount into dentistry, it's a dream for every dentist to open their own setup. But due to some misfortune, they have to shut down the clinic. So in today's topic, we'll talk about failures in clinical management. So today we have Dr. Nithya with us, who's going to share her experience. I welcome Dr. Nithya to our show. So when did you finish your dentistry? After that, did you plan to work in a different clinic?
I've completed my dentistry in June 2014, and post that I have a few months of clinical experience too. I was practicing in a clinic. However, it was for a very short duration. It was not much. We had it only for a few months, but I do have clinical experience too.
So when did you plan to open your own clinic?
I think me and my partner, we started this setup. We both had this thrive to start our own setup ever since we completed. So we were so planned, we were so equipped also. Financially, we had a lot of backup by then. Parents were funding, of course, because we both were freshers, but we did have enough experience to take up a startup because we were managing a clinic, individual clinics, totally by ourselves. So we thought this is a good to go. When we can manage somebody's clinic and give them so much of profit, why not do it for our own self? And so we thought we will take it up from there. So that's how it started.
So how much amount did you invest?
We had invested around 38 lakhs, and me and my partner together, we had an investment done. It was on a percentage basis. When we had started a clinic, I already had my son. So he was a toddler, so I couldn't devote much time to him. So that's why my percentage of investment was more than her. So that's how we actually balanced it.
How did you share your responsibilities?
Yeah, as I said, I had a son by then, so my timing was very important for me. I couldn't give my child entire time, neither to the clinic. So my friend, who was my business partner also, she took up a lot of time. So we would manage it according to timely basis. Where she would not be able to make it up, those were the days when I would do, and the days when I would not make it up, she would do. If we both are making it up, then we would make sure that we do it part-time, like for a few hours she would take it up, and for a few hours I would take it up. Like in a day from 8, our clinic would start in the morning to 8 in the night. From 8 to 3 or 4 if she is there, from 4 to another 8 in the evening I would take it up. Like we kept it very feasible and flexible for both of us.
How big was your clinic space?
Yeah, it was a huge clinical space. It was around 3,200 square feet. And it was not only a dental clinic setup, we also had a pharmacy, we had a lab, we also had a physician, and also a general bed. And we had gynacs. We were 2 gynacs who would visit. We had a lot of gynac procedures that would happen, like placement of copper teeth, removal of copper teeth, and all that would happen. And we would have dressings on a regular basis. So yeah, it was a huge setup.
So on what basis did you choose the clinic location?
Yeah, my clinic was primarily located in a junction where just opposite to the clinic we had an apartment. Now this is an apartment called Prestige Misty Waters. It's basically in Kempapura where my clinic was set up. They had around 6 towers, and each tower had 24 floors. Each floor had around 8 to 9 apartments each, so opening around to 145 apartments per floor or something like that. So per tower. So it was a huge investment. That when we saw it was the best place we could have a clinic. but unfortunately only 11 flats were occupied and we didn't know this.
So can you tell us how much was your advance and your rent?
Yeah, my advance was around 6.5 lakhs and my rent was per month 65k. So basically there's a rule in Bangalore, like every commercial property that you opt for, you have to pay 10 months of your advance as your rent, as your advance, and then you have to pay every year 10% hike. That has to happen. So this is a basic rule no matter where you set up. So we had to abide by the rules.
Do you think the rent was too much?
Yes, we did. We did initially feel, because we being freshers with a very little clinical experience of a year or so, getting into a huge setup where we have to pay 65 was definitely an out of the world task for us. We were most of the days worried how we going to pay the rent. But we had a financial backup. Be it our friends, our family, like we were very close, and they had, luckily they were financially abundant. So at that point, so they could give us that stability. Then they said, go ahead, we are there.
So did you do anything to promote your clinic? So was it helpful?
Yes, we did a lot of things. We did a lot of things like conducting camps. We did a lot of camps in and around schools there. We did because we knew a lot of, we both had a lot of contacts. So a lot of schools were involved. We did a lot of campaigning. We did a lot of discount charges for those people who would come. And luckily that we had a pharmacy. There was a lot of people. There was always crowd, but none of them would become a patient. So we could always pull the crowd towards us, but we never made patients for our clinic. So what essentially used to happen, when people would come to the pharmacy, we would give them a discounted price. They would avail the offers, they would go, but they would not become a dental patient just because of that scenario. They do not even want to come in and peep in and to see what it is until they are aware of what are the general practices that a dentist do, and they really avail those services. They wouldn't. I don't think we could pull in much of a crowd. We also have a phlebotomist because we had a lab, and she also would do a lot of discount charges and prices. Like, so every business we had there in the setup, definitely we did a lot of camps pertaining to each of it, but nothing could pull in the crowd for us. Both of us had always an insufficiency with patients.
So why do you think patients didn't turn up?
I think, see, friends, basically this is because of the general stigma that's present in the society. Basically, people don't want to go to a dentist. They believe professionally qualified dentists are not that better, and quacks are per se very good. Okay, and also they have this family dentist. If their fathers or their parents or somebody known to them have gone to a dentist and they have given them a good review, they always go by word of mouth than experimenting. So always who's established, always are better established. People who are having fresh talent, raw talent, it takes a lot of effort and time to establish.
How many staff did you recruit?
Yes, we had 3 staffs. One was an attender and a full-time caretaker of the clinic. Another one was a pharmacist. She was also a pharmacist and she would manage the entire pharmacy, and one was a phlebotomist. So we had 3 staff.
So why you selected this huge space?
Yes, when we first saw the space, we actually liked it a lot because of its prime location. And as I mentioned to you earlier, we had this huge apartment also, and we expected a lot of crowd would come in because they didn't have a nearby clinic anywhere. And also we had plans immediately as soon as we saw the space that this is not enough only for a dental clinic. Why don't we pull in a polyclinic setup? So we thought, why don't we pull in a polyclinic? And again, polyclinic with a single bed, it's still, the space was huge. So we thought, why don't we pull in a pharmacy? Then post pharmacy, we thought, no, this is again huge. So why don't we pull in another lab for small procedures like just a collection, blood sample collections. So once we did it, it was almost a polyclinic setup. We had so many things that were happening. And then in spite of all this, yet our spaces, our dental chairs were so spacious, and every dentist or consultant who would come to our clinic would always appreciate it, like how spacious is this clinic. It's very rare in Bangalore to find such spacious clinics. So we were very convenient, and workflow for us to have it a very good work culture, we had selected this. And also, this also recruited one of the very, very important DCI rule, which mentions that there should not be any dental clinics around 200 meters in and around. So we thought this is the best place to start up.
Do you think other dentists are following this rule?
No, not at all. I see every 10 feet, 10 square feet, I think there's another clinic. I do have seen clinics in the 4th level, again in a dental clinic in the 1st level. And also, I would definitely want to know, the saturation is so high in Bangalore with dentists pulling on everywhere. Everybody who comes to study in Bangalore wants to stay in Bangalore and practice dentistry. And what about dentists who are in Bangalore? And few dentists who are in Bangalore have like multiple setups across Bangalore because they know the place. If they're married women, they have one in their in-laws' place, one in their husband, like parents' place. So they have 3 clinics. And men also, they can travel. They know whichever places are hotspots, clinic for sales. They procure them and then they start up the clinical setups. So each dentist has 4 to 5, and freshers who start up, if they can make it, good to go. If not, it's bad.
So before opening your setup, did you take opinion from your family or your senior dentist?
Yes, definitely. Everybody was consulted because this was not our own money, our own earned money. We had a lot of financial backup. As I mentioned earlier, it was most of our parents who were funding us. So we did opinionate, we did take considerations from our seniors, our lecturers, parents, our well-wishers, most of them.
So was it a long-term vision?
We had a very long-term goal when we started this. As I said, this setup also had level 1 and level 2 which were being constructed. So if things were good, it would have gone a great extent. We would have probably been today a multi-speciality setup, but bad.
Did you expect immediate returns after opening your setup?
No, I am sure everybody in the field would know immediate returns we cannot expect in dentistry. We didn't expect any returns for a year, but it didn't pick up even after that.
So was it easy to run the clinic with your partner?
Yes, it definitely was. It was much easier for me because my partner was also my best friend, and she gave in more than I did, and I'm sure it would be an understatement if I say that she is more than me into this clinical setup. So she had done everything possible to make it a better place, and we had given her 100%. And the amount of understanding that we had from our college days to our internship days when we were practicing outside to our own setup, I think that bond definitely reflected while we were taking up challenges when the clinic was not doing that great.
How did you cover your overhead expenses?
See, there were a lot of charges. Now, when I say overhead expenses, I'm sure a lot of people will not know what are they. Apart from our basic expenditures like a rent, or salaries for our people, what are the other expenditures when we are promoting your clinic? Even if it is a template or a pamphlet, whatever you are printing, those charges, distribution charges, and extra medicine charges, discounted charges. If a medicine you are giving it on a discount, definitely for the pharmacist or the person whoever is procuring, they have certain commission charges. So all of this comes on to an extra pay. And as I said, if it wasn't for my family who was financially giving me that backup, I wouldn't have made it even that far.
So when it comes to taking leave, was there any clash between your partners?
See, we had an excellent relationship back then, Prince. Even now we do. So we always had this very clear verbal communication. We made things very clear across the table, like who would be there and who would be not. There would never be a difference. Lucky as touch wood, we were never that. We were very, very clear on who would be working on what. Even if we were on leave, we would make sure that there is a consultation that is happening, so that we need not have to be there. There is somebody who was be taking care of the clinic. There were days when we both were not be available, so we made sure we planned in such a way that there are regular consultations, or there's an ortho consultation where the clinic is totally occupied, and we had a very efficient attender who would manage the clinic even in our absence, or any juniors who would want to do an internship like a day or two or something for a proportional project. So we would acquire them. So there's a lot of things we would manage.
So from when did you feel difficulty in handling your clinic?
Basically from the very scratch of unable to paying the rent. I think that's where it hit off. We waited patiently for a year or so, but even after a year, when we didn't see a lot of crowd pulling in, and we could hardly hit 4 to 5 patients a day. That was really bad, because people who would come to the clinic would take medications from the pharmacy, who would do tests from the lab, would come to the general physician also. But we couldn't pull in so much of patients to the dental clinic, though every recruitment, everything that we wanted to do was so perfect, but yet things didn't fall into place. I didn't know where it terribly went wrong. But when we failed to even pay the rent from our pocket, and even after a year, that's when it hit us that we have to dissolve it.
So when was the time you decided to liquidate your clinic?
When we were falling short of funds. when we were facing hardships in paying the basics for our employees. We couldn't pay them salaries. We couldn't liquidate much amount. We were totally losing upon. We couldn't have sufficient funds for rent, and also dentistry is very expensive. So even for the materials, and over a year when the materials were not being used, they get expired. So we had to again, back up those materials, and we couldn't do that also because whatever would come would go in rent. And we also had this pharmacy, wherein pharmacy was taking in a lot of money. People think having a pharmacy is very easy. There's only money coming in, but a percentage of pharmacist earns is also very less. They have 3%, 4%, 1.5% discount on the prices that they procure. So for that also we have to pay, and these stocks that are fast moving have to be reimbursed. So all of this was taking a toll on us. So whatever little money we would earn, we would have to reimburse in the business. We had to reimburse, but it became so much that only the business is getting stabilized. What about the other expenditures? Okay, funding backup also gets backed up at sometimes. That's what happened. Emotionally, it was very, very traumatizing. Mentally, yes, because you're so educated, you have a clinical setup, you're doing so well. People who are probably on the same track with you are doing well, and you're not able to. So that kind of a comparative mindset also has emotional trauma. So it's a dream that we pursued it since we were kids. We've been to a doctor or a dentist, we've seen them work, we wanted to be them, we wanted to replicate them. We wrote prescriptions at home, we grew up, and we sacrificed a lot when we were growing up. Being a doctor is no such easy task. We had 5 years of complete breakdown mentally, only then you become a doctor. Parent dentists go door by door scanning teeth. I think that day has come. So we need not have to really rely on somebody. A few for extra procedures, if you have a good consultation list, that's fine.